In today's COVID-19 update, we speak with the Honorable Minister of Health, Dr. Frank Anthony, about increased vaccination sites and special arrangements being made for HIV patients. The Health Minister also addressed increased COVID cases in Region 9. Thank you so much for joining us today.
Well, thank you very much for having me on the program.
One of the first things that I wanted to ask for, what special arrangements do we have in place for persons with HIV/AIDS who may want to take the vaccine but may not want to go to a public facility?
Well, one of the issues that we have heard is that persons who are HIV positive did not feel comfortable coming to one of our regular vaccination sites. And so, as of this week, we have been working with the National Care and Treatment site here in Georgetown to make that also into a vaccination site. So they should start from this week. So patients going there for their regular treatment, they would be counseled about taking the vaccine, and they can get the vaccine right there. And we're hoping to replicate this at all of our care and treatment sites so that these patients don't have to feel uncomfortable and go to one of the fixed sites. So I think this is going to encourage more people to take the vaccine, persons who are HIV positive. And we're hoping to see better uptake of the vaccine among this population. We will be monitoring with other types of patients as well, and we are hoping that we can introduce a similar service for patients with chronic non-communicable diseases and some of the more popular clinics that we have, that we would use these opportunities to talk to people about getting the vaccines.
I wanted to ask you about more vaccination sites. I was made aware that there is a plan to increase the number of sites that we currently have.
One of the strategies that we're using is trying to get more of our health centers becoming vaccination sites. And as you know, in Georgetown, we have approximately 13 centers that we operate between the Ministry of Health and the municipality. And we've had discussions with the municipality about making 3 of their sites into active vaccination sites. Last week we conducted a training for those persons who will be working there, and as of this week we want to activate that plan where health centers in and around the city would now become vaccination sites. So anybody who requires a vaccine for COVID-19, whether it's first or second dose, we're encouraging you to go to one of these sites where you can get your vaccines. Over the last 3 to 4 weeks, we have seen an increase in cases in Region 9. And over the weekend, we have had a number of testing sites, and our teams in the region would have gone to different villages, and those swabs were sent down to Georgetown. As of today, over the last 24 hours, when we processed those slides, we have had an increase of 134 cases in Region 9, and we now have Lethem having about 53 cases, Tapachinga with 50 cases, St. Ignatius, we've seen about 41 cases. At Sand Creek, which we had seen cases earlier, that has come down a little bit to about 31 cases. And at Ishalton, where we had a lot of cases there too, we have seen a drop in those cases to about 25. And we have seen an increase in the uptake of vaccines over the last couple of days in some of the areas in Region 9 as well. We are also concerned with 2 places in Region 10, Wisma, that continues to have cases, and as of today we have 37 active cases there, 37 new cases rather. And we also have at the Milers ward we have 31 cases. These are cases that we have been monitoring, and over the last several weeks we have seen cases in these areas, and it pretty much has been constant. So that's a worrying trend to have so many cases in a concentrated area. So as of yesterday, we have 235,796 persons who have received their first dose. That's the equivalent of 48.4% of our adult population. And we have currently 114,394 who would have received the second dose of their vaccine. This now brings our total to about 23.5% of our adult population having both doses of the vaccine.
If I had the COVID virus disease, I don't need to get a COVID vaccine anymore.
That's not true, because if you were infected and you have recovered, then you would have antibodies in your system. Now we all know that these antibodies probably would last for a short period of time. Some people have postulated that it would last maybe between 3 to 6 months. But after that, we would normally see a drop in antibodies, and therefore you will become vulnerable to infection. So what is recommended by the WHO is, if the country has vaccines, that as soon as the person recovers, if they would like to get their first dose vaccine, then they can come to one of the vaccination sites and they can get their first dose, and then after that, when your second dose is due, you get your second dose. In that way, you will have a more robust response, and you will prevent any reinfection with COVID.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.